Welcome to Satu Caryu 2.0 online nursing channel. This video contains 50 most important questions for ESI, Safdarjung, MRB, JIPR, RRB, JHSS, MNS Nursing Officer Exams 2019. Before going to see these questions, please subscribe to Satu Caryu 2.0 online nursing channel. Click the bell icon to get the latest updates about our new videos. Let's see the first question of the day. In spinal cord, myelin sheath is formed by option A. Squam cells, B. Oligodendrocytes, C. Osteocytes, D. Microglia. The right answer is oligodendrocytes. Question number 2. A nurse, if reviewing a patient's chart and notices that the patient suffers from Lyme disease, which of the following microorganisms is related to this condition? Option A. Borrelia burgdorferi, B. Bacillus anthracis, C. Enterococcus faecalis, D. Streptococcus pyogenes. The right answer is Borrelia burgdorferi is the organism associated with the Lyme disease. Question number 3. Which referral would be most important for the client with permanent hearing loss? Option A. Aural rehabilitation, B. Speech therapist, C. Social worker, D. Vocational rehabilitation. The right answer is option A. Aural rehabilitation will be very effective. Question number 4. When patient's own skin is taken from donor and graft to recipient's area is called option A. Autografting, B. Xenografting, C. Allografting, and D. None of the above. The right answer is autografting. Question number 5. Which day was celebrated as ESIC Day? Option A. 24th Feb, B. 25th Feb, C. 24th March, and D. 25th March. ESI Day was celebrated in India on 24th February. Question number 6. The ESI scheme was first inaugurated in Kanpur on 24th February 1952 by option A. Then Prime Minister VP Singh, B. Late Chandrasekhar, C. Jawaharlal Nehru, and D. Lal Bahadur Shastri. The scheme was inaugurated in 1952 at Kanpur on February 24th by option C. Jawaharlal Nehru. Question number 7. Which of the following symptoms suggests that child has severe dehydration? Option A. Irritable, B. Restless, C. Who drinks water regularly, D. Lethargic or unconscious. Severe dehydration, the symptom suggests is option D. Lethargic or unconscious. Question number 8. Currently, the ceiling for ESI is rupees. Option A 12,000, B 15,000, C 20,000, and D 25,000. Currently, the ceiling for ESI is rupees 15,000. Question number 9. The forceful expulsion of semen from the urethra caused by the contraction of the smooth muscles in the urethra and the skeletal muscles surrounding the base of the penis is called option A. Emission, B. Ejaculation, C. Climax, D. Neutralization. The right answer is ejaculation. Question number 10. Application of cool clothes to the axilla armpit decreases the body temperature through option A. Conduction, B. Convection, C. Evaporation, and D. Radiation. The right answer is conduction. Question number 11. Match the following. You have two sections. Section A. P. Tendon, Q. Lymph node or ligament, and S. Bursa. Match this with section B. A. Structure connecting bones together at a joint. B. Attaches muscle to bone. C. A small fluid-filled sac that reduces friction between structures. D. Bean shape ranging from P 2. Almond sized. So how we are going to match this? We have the answers and select the best one by reading this. The right answer is option C. The P, tendon, is matched with B, attaches muscle to bone. Lymph node Q is matched with D, that is B shape ranging from P to almond. And you have the ligament. Ligament is matched with a structure connecting bones together at a joint. And bursa is matched with a small fluid-filled sac that reduces friction between structures. This is how section A is matched with section B. Question number 12. Again, I match the following. So you have P, chondrosarcoma, Q, sagittal plan or visceral, yes, inguinal, and you have the section like A pertaining to groin, B pertaining to internal organs, C malignant tumor of connective tissue, D divides the body into right and left parts. So match this. Now you have the answers here. Now let me directly go to the answer. The answer suggests option 4. That is the chondrosarcoma means option C, malignant tumor of connective tissue. Sagittal plane Q suggests that divides the body into right and left parts. Visceral R is related to B, pertaining to internal organs, and inguinal pertaining to the groin. This is how it's matched. Question number 13. The daily insensible water loss from the body normally is in ml how much? Option P, 400 to 200 ml, Q, 400 to 800 ml, or 1200 to 1400 ml. Option yes, 1600 to 1800 ml. The daily insensible water loss is option Q, 400 to 800 ml. 14th question. During first 24 hours of treating a patient for burns, you can assist him assessing fluid replacement needs by monitoring hourly. Option A, vital signs. Q is urine specific gravity, R is IV fluid rate, and S is electrolyte levels. So here, hourly, the nurse must assess the option Q, urine specific gravity. Question number 15. There's an image based question. Identify the equipment seen in the image. A, it is cervical head halter. Q, halopelvic friction, R is pelvic sling, and S is bucks extension. The image shown in the picture is option R, pelvic ring. Question number 16. Who is the chairman of ESI Corporation? Option P, Prime Minister, Q, Union Labour Minister, or Health Minister, and S is Speaker of Lok Sabha. The right answer is Q, Union Labour Minister. Question number 17. OSHA can be expanded as option P, Ontario Speech and Hearing Association, Q, On-Site Hazard Analysis, or Occupational Safety and Health Administration. Option yes, Officers Shop and Housing Authority. The right answer is or Occupational Safety and Health Administration. Question number 18. Normal axillary temperature is P is 37 degrees Celsius, Q is 37.5 degrees Celsius, or 36.5 degrees Celsius, and S is 36 degrees Celsius. The normal axillary temperature is 36.5 degrees Celsius. Question number 19. Width of the cuff size should be dash percentage of the arm circumference, and length of the cuff should be dash percentage of the arm circumference. So width, and we are measuring the length of the cuff. P 40 and 80, Q 60 and 90, or 50 and 80, and S is 60 and 80. The right answer. The cuff size, the width must be 40 and the length must be 80 percentage of the arm circumference. Question number 20 is an image based question. Unit shown in the photograph is stored in the blood bank at which temperature? P is plus 4 degrees Celsius, Q is minus 4 degrees Celsius, R is plus 24 degrees Celsius, and S is minus 60 degrees Celsius. So the blood unit is stored in blood bank at plus 4 degrees Celsius. Question number 21. Identify the deformity shown in the figure. A, that is trigger finger, B, mallet finger, and R is Bortinaire deformity, and S is swan neck deformity. The deformity shown in the image is option yes, swan neck deformity. 22. A 2-year-old child is admitted to a burn unit with partial and full thickness burns over 35% of the body. After admission, assessment, and review of the physician order, the primary nursing intervention focuses on P. Sedation with morphine sulfate, Q. Inserting a Foley catheter, and or inserting a nasogastric tube, and S is restricting the IV fluids. So after admission, the primary nursing intervention should be focused on option Q, inserting a Foley catheter. 23. A patient complains of unilateral eye infections and pain, pressure over his eyes, blurred and decreased visual acuity, seeing halos around light, nausea and vomiting. He most likely has P. Cataract, Q. Retinal detachments or chronic open angle glaucoma, and S is acute angle closure glaucoma. The right answer is option yes, acute angle closure glaucoma is present. These are the signs and symptoms of acute angle closure glaucoma. Particularly note down there is halos around lights. 24. Most common problems of patient with epileptic fits are following except P is episodes of staring, Q blackouts or awareness of seizure has occurred, S is visual hallucination. So which is not the epileptic fits problem. So the right answer is awareness of seizure has occurred. Usually they are unaware about the seizure has occurred. 25. Collapse of the alveoli is prevented by P. cilia, Q. mucus or surfactant, S. pleural fluid. You know that surfactant prevents the collapse of alveoli. 26. A client admitted with C6 spinal injury. In this client, which condition is most likely to occur? P is hemiparesis, Q paraplegia, or is aphasia, and S is quadriplegia. When there is injury to C6 spinal cord, then it suggests the quadriplegia, paralysis of all the extremities. 27. When the nurse is assessing a patient who has cirrhosis of the liver, which of the following findings would indicate that the patient condition is worsening? P is flapping head, and Q is visual field loss, or is positive Babinski reflex, and S is bilateral basal lung cramps. So there will be flapping hand. It is flapping hand. Option P, flapping hand will be present in case of astraxis. Flapping hand is present. It's not head, it is flapping hand. 28. The most common injury among elderly person is P is hip fracture, Q is urinary tract infection, R is atherosclerotic change in the blood vessel, S is increased incidence of gallbladder disease. The most common injury among elderly person is hip fracture. Question number 29. During a Romberg test, the nurse asks the patient to assume which position. P is Trendelenburg, Q genopectoral, R is standing, and S is sitting. Right answer is or standing position assumed by the patient during Romberg test. 30. A 38-year-old patient's vital signs at 8 a.m. are axillary temperature 99.6 degree Fahrenheit, which is 37.6 degrees Celsius. Pulse rate is 88 and respiratory rate is 30. Which finding should be reported? P is temperature and respiratory rate. Q is pulse and respiration. or temperature only? Yes, temperature and pulse. So the abnormal findings here shows that temperature and respiratory rate are abnormal. 31. A 18-month-old had a 18-month-old and has been recently admitted into the hospital. According to Erickson, which of the following stages in the child in A. Trust versus mistrust, Q. Industry versus inferiority, or autonomy versus shame and doubt, and S is intimacy versus isolation. So for 18-month-old, the Erickson stage applied here is autonomy versus shame and doubt. Question number 32. A 34-year-old female has recently been diagnosed with an autoimmune disease. She has also recently discovered that she is pregnant. Which of the following is the only immunoglobulin that will provide protection to the fetus in the womb? P is immunoglobulin G, Q immunoglobulin D, or immunoglobulin E, and S is immunoglobulin A. So the immunoglobulin which crosses the placenta will be immunoglobulin G, which we can administer in this case. 33. A 84-year-old male has been losing mobility and gaining weight over the last 2 months. The patient also has the heater running in his house 24 hours a day, even on warm days. Which of the following test is most likely to be performed? P. Thyroid function test, Q. CT scan, or complete blood count, and S is ECG. So these signs and symptoms indicate there is a thyroid function disturbances in the client. That's why the weight gain is also there, and inability to maintain the temperature, body temperature is also present. So we can go for thyroid function test. 34. A mother has recently been informed that her child has Down syndrome. You will be assigned to care for the child at shift change. Which of the following characteristic is not associated with a Down syndrome? P is brachycephaly, Q oily skin, or clindodactyly, and S is epicanthus folds. The right answer is in Down syndrome, the child will have dry skin, so oil skin is not a feature of Down syndrome. Question number 35. A 35-year-old male has been an insulin-dependent diabetic for 5 years and now is unable to urinate. Which of the following would you most likely suspect? P. Diabetic nephropathy, Q. Somatic neuropathy, and R is autonomic neuropathy, and S is atherosclerosis. The nurse suspect for the autonomic neuropathy complication, which is related to the problem related to urinate. Question number 36. The most common cause of death in aspirin toxicity is P is cardiopulmonary arrest, Q liver failure, or renal failure, S is cerebral hemorrhage. So in aspirin toxicity, the nurse can assume that cardiopulmonary arrest is the most common factor causing death. 37. A second year nursing student has just offered a needle stick while working with a patient that is positive for AIDS. Which of the following is the most important action that nursing students should take? P. Start a prophylactic pentamide treatment. Q. Start a prophylactic zidovudine treatment. AZT means zidovudine treatment. Or seek social support. Yes, go for psychological counseling. So the immediate action the nurse should expect the student will be starting a prophylactic zidovudine treatment, antiretroviral therapy. 38. A patient's chart indicates a history of hyperkalemia. Which of the following would you not expect to see with this patient if this condition were acute? Option E. P is muscle weakness of the extremities. Q. Paresthesia or migraine. S. Decreased heart rate. So in this case of acute hyperkalemia, migraine will not be present, whereas all other three symptoms are commonly seen. 39. A patient has recently experienced a myocardial infarction within the last 4 hours. Which of the following medication would most like to be administered? P. Comodine. Q. Streptokinase. Or atropine. Yes, acetaminophen. The right answer, streptokinase, should be administered to the client who experienced myocardial infarction within first 4 hours after attack. 40. When you are taking a patient history, she tells you she has been depressed and is dealing with anxiety disorder. Which of the following medication would the patient most likely be taking? P is pregloid, Q calcitonin, or elavil, yes, verapamil. So the elavil is a tricyclic antidepressant. This will be administered for this client. Question number 41. A new mother has some questions about PKU, phenylketonuria. Which of the following statement made by a nurse is not correct regarding PKU? P. The urine has a high concentration of phenylpyruvic acid. Q. Mental deficits are often present with phenylketonuria, or the effect of phenylketonuria are reversible. Yes, a Guthrie's test can cause the necessary lab can check the necessary lab values. So the statement made by the nurse is not correct will be, or the effect of PQ are reversible. Question number 42. You are responsible for reviewing the nursing unit's refrigerator. If you found the following drug in the refrigerator, it should be removed from the refrigerator contents. P is urokinase, Q epogen or humulin, and S Corgard. So the drug to be removed from the refrigerator by the nurse would be, yes, Corgard. It is a beta blocker. It's a trade name of a beta blocker agent. It should be stored in the room temperature, not in the refrigerator. 43. A 20-year-old female attending college is found unconscious in her bed in her dormitory. She has a fever and a noticeable rash. She has just been admitted in the hospital. Which of the following test is most likely to be performed first? P is arterial blood gas, Q is blood culture or CT scan, and S is blood sugar check. So the right answer will be the blood culture is done immediately to check for any infection and to detect the cause of fever. 44. A nurse is monitoring a pregnant client with pregnancy-induced hypertension who is at risk for preeclampsia. The nurse checks the client for which specific signs of preeclampsia. Select all that apply here. So this question has more than one answer. P is a negative urine protein. Q is facial edema or increased respiration, and S is blood pressure elevated. So in preeclampsia, what are the findings the nurse should be checked? Select all the things applied here. The right answer is facial edema and blood pressure elevated. This both has to be assessed. Question number 45. A mother is inquiring about her child's ability to potty train. Which of the following factors is the most important aspect of toilet training? P is the age of the child. Q frequent attempt with positive reinforcement, or the overall mental and physical abilities of the child. Yes, the child's ability to understand instruction. So the most important factor for toilet training will be, apart from the age, that will be the overall mental and physical abilities of the child. 46. A nurse is administering a shot of vitamin K to a 30-day-old infant. Which of the following target areas is the most appropriate for administering this injection? P is vastus medialis, Q gluteus minimus, or vastus lateralis. S is gluteus maximus. The right answer will be vastus lateralis, where we can give the vitamin K injection for a 30-day-old infant. The nurse recognizes that a client is experiencing insomnia when the client reports. Select all the apply related to insomnia. P. Falling asleep at inappropriate times. Q. Extend time to fall asleep. R is feeling tired after a night's sleep. S is difficulty staying asleep. All the things you have to select. So multiple answers will be there for this options. So option QRS, extended time to sleep, feeling tired after night sleep, and this one, difficulty staying asleep. These three are related to insomnia. 48. The nurse teaches the mother of a newborn that is ordered to prevent sudden infant death syndrome. 6. The best position to place the baby after nursing is select all that apply. P is Fowler's position, Q prone, or side lying, S supine. So this question also have more than one answer. Select all the position which can be applied for this baby who is having sudden infant death syndrome. The right answer is side lying and supine position. The research proved that these positions are very effective for management of this particular problem of a child. 40 Question number 49. A nurse is reviewing patient's chart and notices that the patient suffers from conjunctivitis. Which of the following microorganisms is related to this conditions? P is Helicobacter pylori, and B is Vibrio cholerae, and C is Haemophilus aegyptus, S is Yersinia pestis. So the microorganism related to the conjunctivitis will be option D, Yersinia pestis. Yersinia pestis. And it's a 50th question. RHOgram is most often used to treat dash mother that have a dash infant. So you have the options. The right answer is RH positive, sorry, RH negative mother having a RH positive infant. Here we come to the end of today's video. Hope you like these 50 questions. Also, if you like these two videos, please click and watch it. Thank you. Bye bye.